And with permission, I'd like to make a statement on coronavirus and about our plans to put us in the strongest possible position for this winter. Like many other countries around the world, we're continuing to see a concerning rise in cases, with 3,991 new cases recorded yesterday. And this week, the number of patients in mechanical ventilator beds has risen above 100 for the first time since July. The battle against coronavirus is not over. And while we strain every sinew to spring free of its clutches, with winter on the horizon, we must prepare, bolster our defences, and come together once again against this common foe. One of our vital lines of defence has been taking targeted action at a local level. We've seen local action work well in some parts of the country, and now we must take further action. Mr. Speaker, we've seen concerning rates of infection in parts of the North East. Sunderland, for example, now has an incidence rate of 103 positive cases per 100,000 population. And in South Tyneside, Gateshead and Newcastle, the figures are all above 70. As a result, local authorities wrote to me earlier this week asking for tighter restrictions, and we've taken swift action to put them in place. From tomorrow, in Northumberland, North Tyneside, South Tyneside, Newcastle-upon-Tyne, Gateshead, Sunderland and County Durham, residents should not socialise with other people outside their own households or support bubble. Hospitality for food and drink will be restricted to table service only, and late-night restrictions of operating hours will be introduced, so leisure and entertainment venues must close between 10 p.m. and 5 a.m. Mr. Speaker, I know, the whole House knows, that these decisions have a real impact on families, on businesses and on local communities. And I can tell everyone affected that we do not take these decisions lightly. We agree with the local councils that we must follow the data and act, and the data says that we must act now, so we can control the virus and keep people safe. And I know that the people of the North East will come together to defeat this virus, as defeat it we must. Mr. Speaker, we're working to bolster our health and care system too. Winter is always a stretching time for health and for care, but this winter presents particular challenges. People will be spending more time indoors than in the summer, where we know that the virus is more likely to spread. And we know that we will need to deal with coronavirus along with the usual pressures that season will bring. So today I want to set out our plans to support the NHS and social care this winter. Turning first to the NHS, I can tell the House that we've allocated a further £2.7 billion to the NHS to support it during winter months. This funding, in addition to the extra funding for PPE and testing, will help the NHS with the vital task of operating safely in a world in which COVID is still at large. And the task, which is critical, of working through the backlog of elective work that was inevitably caused by the first peak. Mr. Speaker, our emergency departments are on the front line of the fight for life in the NHS. Today, I'm delighted to announce a series of measures to support our urgent and emergency care system this winter and beyond. And I want to thank and pay tribute to Catherine Henderson, the President of the Royal College of Emergency Care, with whom I've worked closely to develop these proposals. I want to thank her, and through her, all of those who work in emergency care for their service in the face of adversity. I saw this again this morning at St Thomas's Hospital A&E, and I know that all of us support the work of those who work in our emergency care facilities right across the country. And I very much hope that yours, Mr. Speaker, will be opening soon in Chorley. Mr. Speaker, we will make our emergency departments bigger. Many are simply too small. This was true even before the pandemic, but it's even more acute now. So we're investing to expand capacity in urgent and emergency care so hospitals have the space to continue treating patients safely in the coming months. In August, we confirmed £300 million for emergency upgrades across 117 trusts, and I can today go further and announce £150 million to expand 25 more emergency departments, including some of the most constrained in the country, like Worcester and the Royal Shrewsbury. This extra funding will put us in the strongest possible position for this winter and boost the crucial work to accelerate non-COVID care. Mr. Speaker, it's not just about the space, but about the service. So we're working to get patients the right care in the right place by expanding the role of NHS 111. During the peak of this pandemic, we saw millions of people using NHS 111 on the phone or online to get the best possible advice on coronavirus, helping them to stay safe and, where possible, stay out of hospital, where they could have unknowingly spread the virus. It's crucial that ahead of winter, we use this window of opportunity to seek out what worked and build on it so we provide a better service for patients and protect the NHS. Of course, no one will ever be turned away from our emergency departments in the most serious of cases. However, we've worked with the Royal Colleges, with the NHS and others to develop a better, quicker and more clinically appropriate service for patients by using NHS 111 first. How it works is this. We'll invest £24 million to increase call handling capacity and to make sure that there are more clinicians on hand to provide expert advice and guidance. And we'll build on our trials to make NHS 111 a gateway to the emergency care system, providing a first port of call for patients. So in future, rather than having to queue in an emergency ward, we're testing that people should call NHS 111 first to book an appointment with whoever can give them the most appropriate care, whether it's a GP, a specialist consultant, a pharmacist, a nurse, or community services. And of course, if they need to go to the emergency department, then NHS 111 will be able to book them into an appropriate time slot. We want to see this approach lead to shorter waiting times and better availability of appointments for patients. We'll consult on how its performance is best measured, and with successful pilots, we'll roll out NHS 111 first to all trusts from December. Finally, Mr. Speaker, I wanted briefly to update the House on our work to protect care homes. One of the worst things that we know about this virus is that it reserves its greatest impact for those who are physically weakest, especially the elderly. And so we must do everything in our power to protect residents in social care. In May, we introduced the Adult Social Care Infection Control Fund, which has helped adult social care providers to reduce the rate of transmission. This was used to fund important measures like improving infection prevention and paying staff to self-isolate. And I can now inform the House that we will extend this fund for 6 months and provide over £540 million of extra funding for providers. This brings our total funding for infection control measures in social care to over £1 billion, and we'll also shortly be bringing forward our adult social care winter plan, because we'll do whatever is humanly possible to protect our care homes from this virus so that they're a place of sanctuary this winter. Mr. Speaker, we'll soon be facing winter in this fight, and whether it's on our NHS emergency care wards or in our care homes, we'll strain every sinew to give them what they need so they're well equipped for this pandemic and indeed for the years ahead. And I commend this statement to the House.